around 6 years ago, or just over 6 years, you found intermittent fasting. And this changed your life. So go to the part of the story where you find that, what you're going through, with your health challenge at the time, and how that changed everything.
Yeah. I mean, I was always very fortunate. I've always been thin. Even after having kids, I never had problems losing weight. And all of a sudden I was doing all the wrong things that I thought were all the right things. I was not sleeping enough. I had a husband who did a lot of international travel. I had 2 young kids. I had a very stressful job. Cardiology, as anyone could imagine, you're dealing with the sickest, most acutely ill patient population. And I was doing really intense exercise, like conditioning classes at 5:30 in the morning, and probably not fueling my body the way that I needed to. And perimenopause is like a leveling playing ground. Like, you think you're doing all the right things, but all of a sudden you start gaining weight, you can't sleep, you're anxious. And it's all because of these fluctuations in hormones. Your ovaries are producing less progesterone, which impacts your sleep and anxiety and depression. And all of a sudden you're estrogen dominant. So you're feeling puffy and bloated, and, your gut's a mess. And so, I came to fasting out of the desire to feel better. And I felt better so quickly that it started working into all of the teachings and education that I was doing with my patients. And then, pivoted into me starting programs that incorporated intermittent fasting as well. So I look at it as a blessing. I really came to it out of a desire to feel better. And then I came to realize that, if I feel this good, I'm sure every other woman or man for that matter deserves to feel this good. And so it became an easy strategy to incorporate, largely because on so many levels, a lot of what I had been taught, even as a clinician, was just so blatantly wrong. Like the concept of heart healthy grains and, the food guide pyramid, or the my plate paradigm that really is focused on like 55% carbohydrates. And I'm like, when a woman starts entering perimenopause, you become less insulin sensitive, even if you're at a healthy weight. You start replacing some of your muscle tissue. So it's muscle loss with aging, which is sarcopenia. You start replacing some muscle with adipose tissue. You become much more metabolically inflexible. And this is, I always say it's the start of this metabolic inflexibility piece. And so on a lot of levels, all the information we're giving women is no longer working for them. Like, there is no concept of heart healthy grains, and we don't eat enough protein. We eat the wrong types of fats. We eat too many of the wrong types of carbohydrates. And so a lot of the training about perimenopause and menopause is retraining us to understand prioritizing sleep, doing the right types of exercise, which includes strength training, absolutely critically important, anti-inflammatory nutrition, working on stress management, which does not involve 2 minutes of meditation once a day. Like, you really do have to work at it. And so as I've kind of navigated these years on my own, it's validated or invalidated things that I had known before. And so the beautiful thing is I feel like now I've gotten to a point where I can really advise like bioindividuality rules for everyone, either gender, but really empowering women to understand, like, let's lean in, like, where are you in your menstrual cycle and should you be fasting? Or if you're menopausal, how are you feeling? If your sleep is terrible and you're over-exercising, please don't add in intermittent fasting for anyone. If you don't sleep well, I would say intermittent fasting is not going to save you if you can't sleep properly through the night. And we could unpack like all the changes that occur in the body when you don't have sufficient REM or deep sleep, and the impact on leptin and ghrelin and glucose and insulin response, and how critically and foundationally important sleep is. So on a lot of levels, I'm truly grateful because intermittent fasting gave me back my life. Like I say all the time, I feel more energetic than I did 15 years ago. And I was always healthy on the outside. But I really think it's the way that our bodies are designed to thrive. We are not designed to be eating all day long. We really aren't. And this is such a huge problem here in the States and other westernized countries.
Let's stay on perimenopause and really unpack this. I think this is an area that you can really provide a ton of value for us. And as somebody, who's been through it and been trying all this different strategies, first of all, what age does perimenopause start, or what time frame can people expect to enter that?
Well, I think, to be honest with you, we say 5 to 10 years preceding menopause. And so the average woman in the United States goes through menopause at 51. So a lot of women are in perimenopause in their late 30s. So 37, 38, early 40s, you're there. There's no question. I have women that argue all the time. No, 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 I'm not in perimenopause. I was like, okay. Statistically, I can tell you that you are. However, what starts to happen initially is our ovaries are as old as we are. Unlike men, we don't replenish sperm every 3 days. So if you're 40, your ovaries are 40 years old. You're probably no longer ovulating every month, even if you're getting a cycle. Your progesterone is starting to fluctuate and wane. And that's really the beginning, is this decreasing amount of circulating progesterone from the ovaries. Our adrenals do pick up the slack. But remember, our adrenals are an emergency backup system. But in our over-harried existences, more often than not, people are in a constant state of sympathetic dominance, meaning our bodies are running a marathon, even if we're just stuck in traffic or frustrated with day-to-day activities. So this imbalance in the autonomic nervous system, so parasympathetic, rest and repose, sympathetic, I'm being chased by a saber-toothed tiger. It's an important distinction. So a little more leaning into the adrenals, which means we have to be managing our stress and getting enough sleep. We also get this relative estrogen dominance. And what this means is, because there's not as much circulating progesterone, we'll get a little bit estrogen dominant. But this is also impacted by the estrogens in our environment. So estrogen mimicking chemicals that are in our environment, personal care products, and food are all hugely impactful into that estrogen bucket that we have in our bodies. So one of the first things that we'll start to see as progesterone is waxing and waning, sleep, depression, anxiety, those are the first common symptoms that people see. Number two is that because estrogen predominates, estrogen is this proliferative hormone. So we may feel a little more fleshy. We may feel like our weight goes up. We may experience much heavier periods. I used to call them the crime scene periods. I used to pray I wouldn't get a cycle while I was rounding in the hospital. You may have breast tenderness. You may have acne breakouts. It is clearly letting people know that you are starting to go into this reverse puberty stage. And so for more often than not, what happens is when women are going through these symptoms, what they get offered are antidepressants. If they're lucky, they might get an offer to put them on progesterone, even transdermal, absorbed through the skin. But if you go to the average GYN, what they are going to offer you are synthetic hormones to control your hormones. They're going to offer you an IUD, and IUDs come in different formulations. Some are copper, some are progestin. Number 3 is an ablation. So they go in and they cauterize the inside of your uterus, or they can just take everything out and do a hysterectomy. And so understanding that there are things we can do that are foundational before we ever get to the point of needing hormonal therapy. And by no means am I suggesting that there aren't women out there. There's no judgment. If you decide that's the right decision for yourself, that is absolutely acceptable. But I find that sometimes something as benign as the sleep piece, stress management, removing inflammatory foods, working on gut health, and that involves a good amount of testing. Like I love the GI map, which is a DNA-based stool test. I like the Dutch. I like to look at serum labs, removing toxins, because this sometimes seems like a very intangible subject. People don't really want to know what's in their food. They don't really want to know what's in their water. But I always say, pick one thing, start with one thing. Maybe you clean up your deodorant. I mean, every little change has a huge impact. And then really looking at food quality, like where are you sourcing your food from? You know, I do believe that there's value in buying organic fruits and vegetables, just for even the exposure to glyphosate and insecticides and herbicides, and the net impact of how that impacts the gut microbiome. So from my perspective, the people that do the best managing and navigating perimenopause and menopause are the ones that dial in on the lifestyle stuff. And we know that the people that have the worst symptoms heading into menopause are the ones with the biggest issues related to insulin resistance and blood sugar dysregulation. And so a lot of what my job is laying the foundation so that if they then get to a point where they're like, you know, I've done all these things, everything's dialed in, I think I need a little bit of progesterone. There's no shame in that. I take progesterone every night. In fact, I laugh. It's like the thing that makes sure my sleep is really, really solid. And there is room for hormonal replacement therapy, but you have to lay the foundation first. Otherwise, you will never, ever get to the results that you want. And I think I'm actually grateful that now more and more, a lot of physician researchers are speaking out against the Women's Health Initiative, which ironically enough, when I was finishing up my graduate program, that's when the Women's Health Initiative research came out, that really gave people, not only clinicians, but also women, great fear of taking hormones causing cancer, which has been disproven. But I think it's important for women to know there are a lot of options that don't start with prescription medications. You may eventually get there, and that's okay. There's no shame in that. But that process of perimenopause is 5 to 10 years, depending on the individual. I really think it's a 10-year journey. Retrospectively, average age of menopause is 51. That's 12 years without a menstrual cycle. I have several clients right now who get mad. They're thinking they're almost there, and then they'll get a cycle and they're like, dang, I have to start that clock all over again. But for many years, you may not even be ovulating, but getting a menstrual cycle. But there's lots of ways to tackle symptoms that don't involve prescription medications. A lot of it is lifestyle management. And in fact, the women who do the best navigating those years are the ones that take all those things I just mentioned into account. And some of that is also the fasting piece, eating less frequently, because we also don't need the same amount of food we needed at 18. We're no longer growing, hopefully. But I remind people that eating within a window, whether it's 6 hours, 8 hours, etc., 12 hours, if you're still getting a cycle right before menstruation, can be hugely impactful.
Well, let's go deeper into the intermittent fasting piece at that stage. So if somebody has taken care of the lifestyle stuff and their sleep is good and they have the diet nailed in and they're taking care of their stress in a healthy way, how does intermittent fasting change if somebody's been doing that when they were having a menstrual cycle? As things begin to change with the body, how should they change the fasting?
Well, I think that you have to be attuned to the communication that your body is trying to give you. So I actually think women in menopause have it easier because they don't have as much hormonal fluctuation. I think perimenopause is its own kind of bastion, if you will, that it's very much its own unique properties. And I find for a lot of women, when they're not eating with the same meal frequency, like they're not eating every 2 or 3 hours, their blood sugar is better balanced. If their blood sugar is better balanced, guess what? They don't have hot flashes. They're not waking up with night sweats. Like drenching night sweats for a lot of people is like miserable. I mean, I'm grateful that I never really experienced that. But I think when I hear women describe to me how much better or how their hot flashes have gone away entirely in response to eating less frequently and restructuring their macros, that is the gift that I think for perimenopause for a lot of women, is that they start losing weight even though they've been stuck. They start balancing their blood sugar better, which means they're not having so much blood sugar dysregulation. They're not getting as much hot flashes. They're not having as many night sweats. And in many ways, I've seen many women who feel as if their menstrual cycles are not nearly as heavy as they were before, because they're balancing, oftentimes when you've got excess estrogen around, when you are releasing weight, you will also get rid of some additional estrogen stores. So adipose tissue, for anyone that's not familiar with it, is actually a very sophisticated organ. It is really an organ. It's got inflammatory cytokines and other, components that really can be highly inflammatory. And so if women are storing a lot of estrogen mimicking chemicals or other types of toxins in this estrogen tissue, as they're getting rid of it, for many people, they will lose weight. They'll feel a whole lot better. And I think that is an important focus that we don't talk about enough. The other piece is, as you get better balance between appetite, satiety cues, and appetite and satiety hormones like leptin and ghrelin, you're going to be more satiated. You're not going to feel like you're continuing to look for food, even though you've just eaten a meal, which can be a sign of leptin resistance, which oftentimes goes and coincides with insulin resistance, or even that propensity for being insulin resistant. And for anyone that's listening, trying to kind of determine what these hormones are doing, leptin is really critically important for shutting our appetite off. So if you're leptin resistant, insulin resistant, you may eat a meal that anyone else could eat and they'd feel very full, and your brain may not get the communication that you're full. And so that's an important distinction as well.
So let's move into full-on menopause. Somebody gets to the stage in life when, they're not having their period anymore. What age you kind of talked about it before, because you talked about how long perimenopause goes, but what age can somebody expect to, get to that point? And then how, again, from an intermittent fasting piece, how can they pivot the way they've been doing that?
Yeah. So the average age in the United States is 51, but I see a lot of thin women going in earlier, 47, 48. Some of my heavier patients go through later because they just have more circulating adipose tissue, which tends to be an estrogen rich tissue. The beautiful thing about menopause, which is 12 months without a menstrual cycle, is that you can provided you're sleeping and you're dialing in on stress and you're eating a good diet and you're not doing the cardio queen on the elliptical every day. You're actually lifting weights and walking. I think it's a beautiful time because you don't have as much hormonal fluctuation. So you have the ability to fast. If you want to fast every day of the month, you can do that. You don't have to take into account that you've got a drop in estrogen and a drop in progesterone right before menstruation. And you're trying to navigate your hormonal fluctuation day to day, week to week, because things are much more stable. I would never suggest that men and menopausal women are similar, but as it pertains to fasting, I think it's much easier for men and menopausal women to fast because they aren't dealing with the fertility piece. They're not dealing with a menstrual cycle. They're not dealing with all the hormonal flux that you experience from when you start menstruating to when you stop menstruating. And so I think that's a really important distinction. Again, I always go back to what's your sleep like? What's your energy? Really checking in with yourself. I have women that will message me all the time and say, I was sick, whether it was with, the pandemic or some other illness, can I still fast? And I always say, what's your energy like? Lean into what your body's telling you. I think the most important thing for us is to be hydrated. But if you're sick and you're not feeling well, you can absolutely fast. However, if you feel like, you have no energy and you're miserable, then, maybe have some bone broth, have something that's going to be nourishing, but is light on your stomach. And so really encouraging women to lean into their intuition and the cues that their bodies are telling them. This is very different than what I used to tell patients when I was a new nurse or new nurse practitioner. It was very like every patient gets this versus now it's really very individualized, encouraging women and men for that matter to lean into what their body is suggesting or telling them and feeling comfortable and confident with that information.
If you enjoyed that clip, press here for the full episode. I'll see you over there.
On a lot of levels, I'm truly grateful because intermittent fasting gave me back my life. Like I say all the time, I feel more energetic than I did 15 years ago.